Welcome, everyone. Thank you for joining us today for the Coronavirus Q&A with Dr. Lindsay Carter, the medical director here at Devoted Health. My name is Erica Villa, and I am on the Devoted Health marketing team. We're excited to welcome back Dr. Carter as our special speaker today. Dr. Carter is a medical director here at Devoted Health. She received her MD from Harvard Medical School and MBA from Harvard Business School. She's been practicing medicine for 8 years and also teaches at Harvard Medical School. For today's session, Dr. Carter will give an overview of what we've learned about the coronavirus so far and resources available to you. Then she'll take questions. Before we begin, let's go over a few notes on how to best participate. First and most important, for your privacy, do not share any personal health information when you ask your questions. If you have specific health questions about your personal situation, call our guides at 1-800-DEVOTED TTY 711. That's 1-800-338-6833. If you're exhibiting symptoms of the coronavirus, we recommend calling your primary care doctor as soon as possible. If you want to ask questions, there's two ways to do so. If you joined us through Zoom, that's the link we posted at the top of devoted.com. Click on the chat button to ask a question. A chat box will appear. Type in your question and hit enter. Be sure to include your name and phone number. In case we can't get to every question during the session, we'll call you and follow up. Feel free to start typing in your questions at any time. If you're joining us through Facebook Live, you'll need to call our guides at 1-800-DEVOTED to have your questions answered directly. Do not enter your questions into the platform. A technical note as well. Since we at Devoted Health are all doing our part to stop the spread of coronavirus by working from home, our connection may cut off at times. We apologize in advance for any audio drop-offs. If the audio is cut off, we will do our best to repeat the question. Now I'm going to hand it off to Dr. Carter to get us started.
Thank you so much, and thank you all for joining us this afternoon. If the coronavirus and the disease it causes, COVID-19, represent an extraordinary challenge for all of us, and we at Devoted Health are committed to caring for you like family, and so we want to do everything we can to help you through this challenging time. I hope this webinar and the opportunity to ask questions will be helpful to you all. And if you joined this webinar 2 weeks ago, this will be similar material with some updates and of course, again, opportunity to ask questions at the end as well. I'll start again by saying that it's been several months since this all started, and I recognize that many people, myself included, are feeling fatigued by all of the news and the recommended precautions. And so I want to talk to you today about the things I think are really important for everyone to know. The coronavirus will likely be with us for a while. It will ebb and it will flow. And so it's important that we're all prepared. I'll start by going through some facts and figures, then we'll talk about how you can protect yourself, what we at Devoted are doing to protect you, and then we'll go through some just frequently asked questions that I anticipate, and then open it up for questions again towards the end. So to start with some facts and figures, by now, I think most people have seen the numbers in terms of rising cases across the country. And you'll see here sort of numbers that were updated from just today. Over 3.5 million cases across the country with over 137,000 deaths. And the cases are surging in a lot of states, including notably Florida and Texas, which is where we at Devoted have our members. And unfortunately, because the number of people hospitalized and the percent of people testing positive out of all of the cases, because those two things are also rising, the case spike cannot be solely explained through increased testing. There is increased disease activity that we're seeing in Texas and in Florida and across the United States. The next slide goes into a little bit more specifics on Texas and in Florida. And I just show this to show individually for these two states, sort of the status of the cases that we have. As mentioned, cases, again, you can see are both on the rise in both states. We're hopeful that we're sort of about at the peak. You can see potentially some leveling off starting to happen, but it is still too early to say. And we know that there is a great deal of cases in both states, unfortunately. The next slide, I'll talk about how we think the virus is spread. There's a lot of discussion of this in the media. And at this point, again, we're still learning a lot about the virus. It's still very new, and we have a lot to learn. But we do know that we think that the virus is mostly spread from person to person contact. So it's when people are in close contact with another within 6 feet and through the respiratory droplets that are produced when someone who is infected coughs, sneezes, or talks onto another person and directly transmits those infected droplets to another person. It's important to note that it can be spread by someone who's infected but not showing symptoms. And this might be because the person just hasn't started showing symptoms yet and might be sick in the next couple of days. But we also know that there is a percentage of people that never go on to show symptoms. These are the asymptomatic infected people. And so that's why some of the measures that we'll talk about on the following slides for how to protect yourself are so important. We do think you may be able to get the coronavirus by touching a surface that has the virus on it and then immediately touching your mouth, your nose, or your eyes. But this is far less likely. I'll underscore again, we think that the vast majority of the transmission really is person to person. So while the disinfecting and cleaning surfaces is very important, the person-to-person spread is really the biggest place where the virus is spread. Currently, there is no evidence that food is associated with spreading the virus. That's something that does come up in a lot of questions. We don't have evidence of that, but again, we are continuing to learn more and more. But currently, no clear evidence that food is associated with spreading the virus. The next question is to think about whether or not would be at particular high risk if you were to contract the virus. And high risk, what I mean by that is to have then a severe illness. So there are sort of two buckets that we think about that are high risk for a more severe illness with the coronavirus. One would be chronic illnesses at any age, and the other would be older age. So the chronic illnesses that you see on the left-hand side, this is certainly not an exhaustive or complete list. There are many more chronic illnesses that may put you at increased risk. But the ones I've listed here are the ones that we know are associated with more severe cases of the coronavirus. And those include chronic kidney disease, chronic obstructive pulmonary disease or COPD, a weakened immune system, particularly after you've had an organ transplant, obesity, serious heart conditions like coronary artery disease or congestive heart failure, sickle cell disease, and type 2 diabetes. And then on the right side is that second bucket of older age. And unfortunately, 8 out of 10 deaths to date from the coronavirus have been reported in adults who are over 65. And so this is thought to be the really important second group that is at higher risk from poor outcomes if you were to get sick from the coronavirus. Now, these two buckets don't mean that you're more likely to get sick, but it does mean that if you were to get sick, that your case might be more severe than another case. The next slide goes through the different coronavirus testing that we have available. And there are two major tests available right now. One is the diagnostic test, also known as the PCR test or the RT-PCR test. And that's what helps answer the question of whether or not you currently have the virus. That's what's done through the nose or throat swab at an office, hospital, or testing site. And the testing guidelines differ from site to site, but generally it's recommended that you're tested if you're having symptoms. The antibody test, which is also called a serology test, helps to answer if you had the coronavirus in the past. And it's recommended to wait at least 2 weeks after you've potentially had the coronavirus for this test to be useful. It's a blood draw that's done at the office or laboratory. And again, it tells you if you have antibodies to the virus, or that if basically if your body has mounted a response to the virus to suggest that you were exposed or that you had it. These tests, the antibody tests, still have high rates of false results. So generally speaking, they're not being used in widespread fashion just yet. So if you're interested in having the antibody test done, we do recommend checking with your healthcare provider to see if they offer antibody tests and whether it's a good idea for you to have one. Again, at the very least, we recommend waiting 2 weeks after you think you might have been sick, as this is the time it takes for your body to create the antibodies. I'll also note on the testing is that there is emerging a new test that I don't have listed here, as it's not as widely available yet, but an antigen test. That antigen test is the same technology that is used for things like the rapid flu test that many of you may have had done before. And what that antigen test does is it quickly identifies whether or not you currently have the virus. So it's a second way, in addition to the PCR test, that doctors may be able to tell if you currently have the virus. And more to come on that. We don't have widespread capability for the antigen test just yet, but the hope is that that will be available more widespread in the coming weeks. So next is treatment. Unfortunately, there is not yet a specific coronavirus treatment, one that we know treats the virus very well, nor is there yet a vaccine, though I'm sure many of you have seen on the news promising results from early trials on the vaccine. And so we're all hopeful that that turns into a successful vaccine in the near future. However, there are several medications that are under investigation right now, typically for use only in the hospital for when cases are very severe. And the two that I have bolded and starred are the ones that have shown some promise. Remdesivir is the first medicine. That's one that is a medicine that helps attack a virus. And it's shown that it does lead to faster time to recovery, but has not unfortunately been shown to reduce deaths. Dexamethasone is actually a medicine that's been around for a long, long time. It's a steroid. You may have taken it for another reason in the past. And dexamethasone has been shown to reduce deaths from the coronavirus, again, in very severe cases. And so these are medicines that are being used still under investigation in the hospital when you're able to be monitored closely. But we're hopeful about these initial results. I've listed two others, the convalescent plasma and the hydroxychloroquine. Both of those are still under investigation. Convalescent plasma basically means that you take the antibodies from someone who had the virus in the past and actually give that to the person who's sick to help fight the virus better. And that's being studied. Hydroxychloroquine is another medicine that got a lot of press a few months ago. That's continued to be studied with some potential promise, though I'll underscore the importance of being monitored in the hospital when taking that medicine, as there are some side effects that we're seeing and adverse reactions. Again, a lot more to come from researchers who are working very hard to identify medicines that will help. So in the next section, I'll talk about how you can protect yourself and others. This slide shows and talks about just everyday precautions that we should all take. There's unfortunately no magic bullet to help prevent the spread of coronavirus, but the combination of these four things can drastically reduce the risk of contracting the virus. And so by doing all four together, that is really the safest thing for you to keep yourself healthy and to protect others. So number one is the idea of social distancing. And it's the idea that you want to put distance, of course, between yourself and other people outside of your home. And so we recommend keeping at least 6 feet if you can, because that's the distance that we think the virus might be able to travel if someone were sick. The second is covering your mouth and nose with a cloth face cover when around others. So face masks, of course, are becoming more and more widespread and recommended that everyone wear. I'll talk a little bit more about face masks on the next slide, so I won't get into it in a lot of detail here, but that is the sort of second piece of everyday precautions is wearing a face mask when you're outside of your home. Third is washing your hands often. And this is so important because even if you were to say touch something that had the virus on it, like I talked about on a previous slide, if you're washing your hands often, the chance that you would get sick from that, even if you did touch something that was infected, would be extraordinarily low by washing your hands. And so that's why we recommend just diligent hand hygiene. It's important not only to protect yourself, but if you happen to be sick, by washing your hands often, you're also less likely to spread it to others. And last, cleaning and disinfecting surfaces, especially high touch surfaces that other people may be touching, like doorknobs and other handles and things like that. So we recommend doing that in your home as well. So I thought that this picture kind of really nicely shows how the benefit of masks. So masks are recommended for everyone to wear now, cloth masks for everyone to wear outside of the home, because the main benefit is that it actually protects everyone from someone who might be sick, that is a COVID-19 carrier, from spreading it to other people. So if a sick person is wearing a mask, that mask is going to capture and block the virus from getting out into the world and from infecting other people. That's really the main benefit of the mask. So if everyone were to wear them, you can imagine then that the spread would decrease drastically by reducing that spread from anyone who might be infected and showing symptoms, or maybe infected and not showing symptoms yet. There probably is also some benefit to you directly as a healthy person wearing a mask in terms of preventing the virus from getting to you. But that's a smaller piece. Again, the bigger piece is the fact that the mask really protects all of us from people who are infected from then spreading it. And so you'll see in the top left picture, if nobody's wearing a mask and there's an infected person, or labeled here as the COVID-19 carrier in the blue, that person has a very high risk of then infecting the healthy person who's also not wearing a mask. If you go to the bottom left, even if the healthy person is not wearing a mask, the fact that the person who has the coronavirus is wearing a mask actually makes the infection risk very low. On the top right, um, if the infected person is not wearing a mask, but the healthy person is, the risk might come down a little bit because that healthy person is wearing a mask, but it's still very high because the infected person is not. And then the bottom right, you'll see the risk goes down as much as possible when everyone is wearing a mask. So the carrier or the infected person is not going to transmit it as much, and the healthy person has the small added benefit that the protection that the mask affords as well. So that's why it's so important for everyone to wear them. So what do you do if you feel sick? The most important things, of course, are to stay at home and separate yourself from other people right away. We also recommend that you call your doctor to let him or her know that you're feeling sick and get guidance in terms of any additional care that you might need. Many times, especially of course with mild cases, we don't recommend going in to be evaluated, possibly to have the testing done, of course, but otherwise not to go in to see the doctor, because most cases are able to be managed from home. But it's important to let your doctor know what's going on so he or she can keep an eye on you and check in on the phone. We also want you to call us, of course. I'm going to talk a little bit about our COVID monitoring program a little bit later, but we have a program where we would be calling you and keeping track and making sure you're feeling okay and not getting worse. And so you're always welcome to call us. And then we recommend, of course, that you monitor your symptoms if you're feeling sick. So the common symptoms of the coronavirus are ones that I think we're all familiar with. cough, shortness of breath, fever, sore throat, other respiratory symptoms. But it's really important also to monitor for these emergency symptoms that would suggest that you need sort of higher level of care, that you need to be seen, that you need to be seen in the hospital. So those emergency symptoms would include a lot of trouble breathing, persistent pain or pressure in your chest, if you're newly confused, if you can't stay awake or your family members can't wake you up, or if you have bluish lips or face, which suggests your oxygen levels are very low. If any of those emergency symptoms occur, we recommend calling 911 or seeking emergency care right away. A question that comes up a lot is isolation, and so what to do if you think or you know you had the virus and how long you need to stay away from people. And the current guidance per the Centers for Disease Control is that you can be with others if you've had 3 days with no fever, and that means you're not taking Tylenol or another medicine to help reduce your fever anymore. So 3 days with no fever and no medicines that are reducing your fever. Your respiratory symptoms have improved, so the cough and shortness of breath have improved. We do recognize that unfortunately the cough can last a while with people who have had the coronavirus. So that's why we don't say it has to go away completely, because some people do find that they continue to cough for several weeks. And it needs to be at least 10 days since your symptoms first appeared. Studies have shown that the most infective period is in the first 5 days or so. And so we recommend 10 days since the symptoms first appeared, and those two things as well, with 3 days without fever and your symptoms generally improved. And if all of those three things are true, then we do think it's safe for you to be with others again. So the next couple slides, I'm going to talk about what Devoted Health is doing to help protect you. So we'll talk a little bit about telehealth, we'll talk about medicines and ways we can get them to you safely, food support, and then the coronavirus monitoring program that I mentioned briefly just a bit ago. So telehealth is so useful because you can communicate with your doctors often without having to do in-person visits. And that's true, generally speaking. That's true independent of the pandemic. It can save time, it can make it easier and safer for doctors to see patients. And that's especially true during this pandemic. Right now, we think it's safest to stay out of the offices to avoid exposure to the virus if you don't need to be seen in the office. Many offices have minimized in-person visits because of this. Again, we recommend that you speak to your doctor one-on-one to make sure that it's safe and okay for you to do a telemedicine visit. Everyone is different, and your individual circumstance may require that you have an in-person visit. And of course, we defer to your doctor and you to decide that. But we do want to just mention that telemedicine and telehealth can be useful in a lot of circumstances and avoid unnecessary in-person visits when possible. Telemedicine visits can come in two flavors and actually is pretty easy. You can talk to your provider just like you were there in the office. So you can have a pure telephone visit where all you need is a phone and your provider would basically just call you at your designated time. Or you could do a video visit, which does require either a smartphone or a computer for you to connect to the internet. And most times there's programs where you basically just click a link to enter a waiting room, and you don't need to download anything or create an account, which is easy and useful. But these are two ways that offices can do telemedicine visits. And again, your own primary care office or your specialist office may have different ways of doing things. We encourage you, if you haven't already, to make sure that you know what your provider is offering. So in addition to contacting your own primary care provider, I also just want to mention that we at Devoted Health have a team of doctors and nurse practitioners who can also do phone or video visits, and we will work closely with your primary care doctor as well So if you're unable to reach your primary care doctor or they're not offering services like this and you're interested in a telehealth visit, please do contact us. The phone numbers are listed below. So for Florida, you can call 954 526 9743. And for Texas, you can call 713 597 5114 if you're interested in making one of those appointments. The next few slides we'll be talking about getting your medication safely, because we of course want to make sure that you're continuing to reliably get your medication safely and on time. And again, we want to keep you safe at home as much as possible. So these options that I'll talk through are the ways that you can do that. So there are three ways to get your medicines, of course. There's pickup, then local delivery, and mail order. Pickup is probably what you're used to, going to the pharmacy to pick up your medicines. And we're most worried about this right now. We, of course, want to minimize trips outside of the house if we can. But if you have to pick up your medicines at the pharmacy, you might look into a few options to make it a little bit safer, such as drive-through options that some pharmacies have, or special senior-only hours that they may also have. Your local pharmacy may also offer local delivery. Many pharmacies are now doing that. So it's best to call your pharmacy to see if that's an option as well. And then last is mail order. There are several mail order options that I'll go into in more detail on the next slide, but it's a great way to have your medication safely and conveniently delivered. Some options kind of help you remember to take your medications. Others package your medications all in one place, the meds for a given day in one place. And so we think these mail order options also might have a lower risk of shortages of medicines. We fortunately have not seen many shortages, which is a good thing, but we think that the mail order may have a lower risk if shortages were to occur. So I'll go through a little bit more detail, three of the mail order options that we have. So CVS mail order is when there's the 90-day supply delivered to your doorstep through the CVS service. It's very convenient and safe. You get 90 days at once, so you may have lower copays under your plan. The one drawback for some people is that they don't feel comfortable leaving a credit card on file with CVS. So that is a potential drawback there to keep in mind. PillPack is another company that does mail order. It basically packages your medications into daily doses, so it's easier to remember when you need to take it. The service of the packaging is actually free, so you just pay your normal 30-day prescription copay for the medications. They do spend a good amount of time on the phone with you going through your medications, and so that usually takes about a half an hour, so just something to note if you're interested in setting it up. Last is MedMinder. MedMinder helps you to remember to take your pills by providing a free electronic pill box that tells you whether or not you took the meds when you were supposed to. This is a great option if you have trouble remembering your medications or if someone else helps you with your medications. Again, the service itself is free. You only pay your normal 30-day prescription copay for the medications, just like if you went to a regular pharmacy. The next thing I want to talk about that we can help with is helping with food. And of course, we want to make sure that you have the food that you need and you get it safely. So there are a couple options here that I'll talk through. And if you'd like help with any of these, I encourage you to call 1-800-DEVOTED to get more assistance. We can help you with local delivery by helping you order your groceries online if you need assistance. May or may not be may or may not apply. Be applicable to you. And if you do qualify, we may help you apply for those food stamps or find local food pantries. The next slide just is a reminder that we have a lot of this information on our website. So if you want to do it yourself and you're not interested in having our help in walking through those options I mentioned, you can go to our devoted.com website. There's a banner at the top that says coronavirus. If you click on that and then scroll to the section about groceries, there's a section there that includes safety tips and how to do grocery delivery in your area, as well as senior hours and some information on local food banks. So we encourage you to look at that if you'd like any assistance with your food or groceries. Last, in terms of what we at Devoted are doing for you, I want to talk about the member coronavirus monitoring. So for our Devoted Health members who have symptoms of the coronavirus, are confirmed to have the coronavirus, or if you have a known exposure to someone with the coronavirus, we have nurses call you on a regular basis to check in over the phone and make sure you're doing okay. We can help facilitate testing if that's what you need, and just make sure in general that you're feeling okay, and connect you with any care that you might need. For some members, in particular those who are confirmed to have the coronavirus, we might also be able to send a pulse oximeter, which measures the blood oxygen level to help monitor that and make sure that that's not dropping low. Again, that's for members who are confirmed to have coronavirus or are very suspicious of having coronavirus. That's something additional we may be able to offer as well. So last, I'm going to talk a little bit about some frequently asked questions before we open it up for general questions. And these are some things that I just anticipate or things that are sort of on the news a lot. And so I want to sort of talk about this a little bit. So one question is, can I travel? And so I want to start by saying that the answers to can I travel, and then the third question of can I see my family, both of those are ultimately individual decisions, and there's no one size fits all answer for anyone. But I'll give you some general guidance to think about. For travel in particular, we know that travel will increase your risk of getting infected. And so therefore, staying at home really is the best way to protect yourself and others from getting sick. If you must travel, there's some things to keep in mind. One would, of course, be the way that you're traveling. So if there's a way that you can travel such that you're able to maintain the social distance of 6 feet from other people, that's, of course, safer than an option where you can't maintain the social distance. It's also important to think about whether you or anyone you're traveling with is at particularly high risk of getting very ill from the coronavirus if you were to get sick. And if that's the case, then we'd strongly encourage you to stay home and not to travel because that risk, again, of getting sick does increase with the travel. Um, and, and in general, just thinking about whether or not it's necessary for you to travel is, of course, important. And we recognize that sometimes you can't avoid it. And so if you do need to travel, make sure that you take every precaution you can to stay as healthy as possible by maintaining the social distance, wearing masks, and practicing very good hand hygiene. The second question is whether or not your pet can get sick. At this time, there's no evidence that animals play a significant role in spreading the virus. The risk of animals spreading it is considered to be extraordinarily low. There's potentially some case reports that we've seen the virus spread between people and animals in some situations, but again, that evidence and that research is still emerging. And as of the information we have to date, we do think that risk is extremely low. So that is the good news. To be safe, however, we recommend generally treating your pets like you would other human family members and trying to maintain social distance for your pets as well, and not letting your pets interact with other people outside of the house if that's possible for you. Again, this is rapidly evolving situation. Information will, of course, be updated as it becomes more available. The third question is the toughest one, I think, and this is, can I see my family? So social distancing in the very strictest sense means that you only would see people who are inside of your home, your direct home. And that I recognize is really hard to do. And it's really hard to do as these months have gone on and it's been a long time since many people have been able to see their loved ones. And so this is where, I mentioned it's not a one size fits all. Ultimately, you have to make your own decisions based on the risks. But here's some general advice that I'd give to anyone. Remember that it is just a true fact that any increased contact outside of your immediate house does lead to increased risk of contracting the virus. But the contact that you have outside of your immediate house is not all equal. So, for example, if the family members that you wanted to see, your children, your grandchildren, if they're also being extremely careful and only seeing people within their own house, then perhaps that's okay because the risk, of course, is extremely low. However, if the family members you were hoping to see by necessity have to have a lot of contact with others outside of their house because of work or other situations, then of course the risk does increase substantially. And so I encourage you to sort of think about what those risks are in your own individual situation. In your own risk and vulnerability also, of course, comes into play. If you're particularly high risk because of your age or chronic illnesses, you of course want to be extra careful. And that's especially true, I think, in the next few weeks in the peak of the pandemic. As we see increasing cases, we want to make sure that everyone is staying as safe as possible. Last, of course, contact with family is not all equal as well. So if, say, for example, you are able to see your family outside at a distance, then that's maintaining good social distance. And I'd encourage you to think about ways like that that might be safer for you to see your loved ones. Again, not a one size fits all, I recognize. And I recognize just how difficult it is during this time to be separated from your loved ones. But I encourage you to think about, for your own individual situation, the risks and the benefits and sort of ways you can do that most safely. Last, I want to touch on how the virus is affecting children, as this is something that is emerging as well. And so we're recognizing the multi-system inflammatory syndrome in children, which is a condition where different body parts can become inflamed, including the heart, the lungs, the kidneys, the gastrointestinal organs. Researchers are not yet fully sure what causes this syndrome, but we do know that many children who have this inflammatory syndrome had the coronavirus. And so the concern is that, of course, it's a consequence of the coronavirus. It can be very serious as well, with many children requiring being in the hospital to get better. And so again, this is something that is scary, and we're watching very closely, and we'll provide updates as they become available. So the takeaways in terms of what we talk about today, again, want to just make sure, of course, everyone is aware that the cases are on the rise, especially in Texas and in Florida. The best way to protect yourself and others is the combination of social distancing, face masks for everyone, frequent hand hygiene, and cleaning and disinfecting of frequently touched surfaces. We do, of course, at Devoted have programs in place to keep our members safe, including ones to help you with medicines and food. And we have the monitoring program if you have symptoms or a known exposure to the coronavirus. We would love to help you and reach out and make sure that you stay safe. So at this point, I just want to thank you for listening, and I'll open it up to further questions.
Dr. Carter, we don't seem to have any questions at this time. However, you did go out a little, your audio fell off during the slide where you were going through the additional resources or assistance that we can give our members. So I don't know if you want to repeat that while we have some of our members type in their questions.
Sure thing. Was it around, do you remember if it was around medications or food or the
Food is
monitoring
the
program?
food. Uh-huh.
The food. Okay, great. I'm sorry about that. My internet has been misbehaving a bit, so I apologize. So this slide shows a little bit on what we can do to help with food. And so if anything is interesting to you here, we do recommend, encourage you to call 1-800-DEVOTED. There's sort of three areas of things that we can help you with. One is that if you need help ordering your groceries online, we can help you do that and help find what services in your area do offer local delivery. So we're happy to help walk you through that. We're also happy to help connect you to local programs in your area that might deliver meals to your home as well. And last, there may be food assistance programs that you qualify for based on your situation. And we'd be happy to help you apply for things like food stamps or find local food pantries, whatever is applicable and available in your area.
Great, thank you, Dr. Carter. I think our members are still a little shy, so we don't see any questions. Oh, we actually got a couple questions. So the first is, how thick should a mask be to be protected?
Good question. So the general guidance right now is that it should be a 2-ply mask. So 2 layers of the cloth is thought to be adequate to sort of adequately protect. Again, that's really mostly so that it protects people who are ill from spreading it to others. And so the 2-ply is most helpful there. Of course, I went through the fact that we think and we hope that there's an additional benefit just for healthy people as well by wearing the mask to help protect themselves. And so you want to, of course, make sure that it sort of fits snugly around your face and your nose also for the sort of optimal coverage. But 2-ply is thought to be adequate for the thickness.
Great. And then we have a second question inquiring about the metabolic immune. So I'm not exactly sure what they're asking, but the question written out says, is it not true that metabolic immune at optimal?
Hmm. I'm not totally sure, unfortunately, what the question is asking. So maybe encourage a person maybe to type in some additional information. I'd be happy to try to answer it. We can also actually take down if the person who left the question wants to leave their phone number. We can just make sure that we're connect with you after the webinar is over to make sure that we address the question.
Great. And we don't have any more questions, Dr. Carter, at this time.
Okay, maybe we'll give people a few seconds in case anyone is currently typing. Here we go. We got one I see that just popped up.
So the question they're asking is, what can be used to wash our fruits?
Yes, so good question. So generally what is actually recommended at this time is just good copious water, washing with good water. Some people, and that's thought to be the safest. Some people, of course, want to wash with additional sort of soap and things like that. What I would encourage you to do if you feel that you want to wash with some soap, like things like an apple or something that you can easily wipe off, is that you make sure that you make sure to rinse it very well with a lot of soap. Just because you don't want that soap residue to stay on there, because that could be unhealthy for you if you were to eat it. So again, lots of water is actually what the Centers for Disease Control is recommending at this point, nothing additional. But if you were to use something like soap and you felt that you really wanted to, just encourage you to make sure that you wash it very carefully to make sure that you remove all of the residue.
Dr. Carter, would vinegar be a good substitute as well to soap in cleaning fruits?
Yeah, vinegar solution, like a white vinegar solution, is also sort of out there in terms of another option. Again, I would make sure that it is a diluted solution. And then as with anything, you want to make sure that you are absolutely rinsing it off with plenty of water as well. So you definitely want to make sure, again, a diluted white vinegar solution may be appropriate. Just make sure that you need to make sure that you are washing everything off with plenty of water so that you're not sort of ingesting any of the substances as well.
Great. So we have another question that came in asking if immune levels dictate getting the virus.
Got it. And I see it looks like this might have been the clarification from the first question. Um, so we do we do know that, of course, your immune system is what helps protect you against the virus. And if you have an immune system that is compromised for some reason because you're on certain medications, for example, you're on certain medications like certain high dose steroids for certain inflammatory conditions, or if you had a transplant, there are many immune suppressive medications that suppress your natural immune system and suppress your natural ability to fight infection. And so we do see that especially those who have a suppressed immune system after an organ transplant, for example, do put you at much higher risk in terms of your ability to fight the virus, and you will get, you're at higher risk for more severe illness. I think we're still understanding in general whether or not people with low immune systems are more at risk for getting it. We think the more of the evidence is pointing to once you get it, you're at higher risk for having a severe illness if you were to get it. Um, Again, we're still relatively new in our understanding of the virus, but the current understanding is a little bit more that decreased immune system puts you at an increased risk for a more severe illness once you've contracted it.
We also have a question in regards to your thoughts on wearing gloves while in the supermarket.
Yeah, so the Um, gloves in the supermarket, of course, can help by protecting, your own hands. But the important thing to remember is wearing the gloves, you still, that surface, the glove surface, still potentially is touching surfaces that are infected. It's important to remember that, because that just because you're wearing gloves doesn't mean then, of course, that you can go touch your face, or touch your phone in your purse, or anything else like that. You would want to make sure that you remove those gloves, and sort of not contaminate with not contaminate any other surfaces. Um, so in general, wearing gloves and also just using very good hand hygiene, like hand sanitizer, are both two very good options just for staying healthy. So gloves are actually generally not something that's recommended that everyone wear. I recognize, of course, that people feel safe wearing gloves, and I do recognize that. But I would just underscore that wearing the gloves means that your own hands, of course, may be protected, but the gloves themselves, those surfaces may still have become contaminated. And so just the general hand hygiene principles should still apply. Again, I don't, there's no specific recommendation for gloves when you go out, like to the grocery store. But I recognize that people may feel more comfortable doing that. Just remember the just hand hygiene principles still apply.
So we have another question in regards to eating meat. So a lot of employees of meat companies were hit with the virus. Are there fears into buying or eating meat at this time?
Great question. So right now, there's no evidence that the virus is spread through food. There has not been any evidence of that. Eating the meat that sort of was at these facilities is not thought to be a way that you can get the virus. Of course, there's always the small risk of the virus living on packages for a while. Again, as we talked about earlier, the major risk is, of course, still the person-to-person transmission, though virus living on packages certainly and surfaces certainly does still present a small risk, and not zero. And so I would say the major concern might be something like with on the packages. However, by the time that the package would get to you, it would have been several days since it left the meat packing plant, for example. So at that point, the virus would not have survived. So even if the virus were on the package and you could conceivably get it that way, the time that would have elapsed from when it was at the plant to when you would buy it, I think would be enough time such that that would not be a concern. Again, just very good hand hygiene is really like the cornerstone and the most important thing here, because even if somehow a small amount got on of the virus was on the package, it would if you are diligent about washing your hands and washing them before you eat, then that risk would go down. So in general, food itself not thought to be a vector or a risk, so not something that we're concerned about. Packages, of course, still a theoretical risk, so just practicing very good hand hygiene is the way to go there.
Great. And we've got one last question for us. Oh, actually, we had another one come in, but one of the questions that somebody just typed in is in regards to OTC, over-the-counter medications or supplements that might help, such as colloidal silver.
Good question. So nothing proven just yet in terms of over-the-counter supplements that would help, but I'll tell you about a few things that have been extrapolated from other viruses. And so one is vitamin D. So interestingly, if you are low on vitamin D, so you're vitamin D deficient, there's some evidence that for other respiratory illnesses, you may not be as good at fighting them off. So for things like the common flu. So there's been a sort of hypothesis that maybe, making sure that your vitamin D level is good could be something that helps you sort of fight the virus. Now, that does not mean that you should go take huge doses of vitamin D. Always ask your doctor first about whether or not it's safe for you to do so. But making sure that your vitamin D levels are normal and that you're not deficient is something that is sort of, a good thing for everyone to do for bone health and for all sorts of other reasons, and may have the added benefit of helping you fight general respiratory viruses. Again, no specific evidence for this coronavirus, but if you extrapolate from other experiences with other viruses, there may be a benefit. So vitamin D is one. The second one would be zinc. And so there have been studies, again, not with the current coronavirus, but with other viruses that cause the common cold and flu, that if you take zinc lozenges, like things like Coldies or Zicam are two of the over-the-counter products. Those zinc lozenges, if you take at the first sign of any sort of symptom like a sore throat, might help reduce the severity of the illness as well. So again, we don't have experience with zinc supplements with this current new coronavirus, but it's another thing that if we kind of take lessons learned from other viruses, that it might have a benefit there as well. So those would be the two over-the-counter supplements that might have some benefit. Would be vitamin D, again, just making sure that your levels are normal and healthy. Again, not saying you should go take big doses of vitamin D, and always make sure you check with your doctor on the safety. And then secondly, zinc supplements that you can buy over the counter and use if you start to feel anything like a scratchy throat might also be beneficial.
Great. And we've got time for one last question. Dr. Carter, does the sun kill the virus?
Good question. I think, we were all hoping that with the warm weather and everything, that the virus would become less of an issue, and clearly, unfortunately, that has not been the case. And so we do not think the sun specifically kills the virus. The virus can live on surfaces even in the sun. So there's no evidence that the sun kills the virus.
Great. And we actually have time to squeeze in the very last question. And so while your feedback on how to handle meat packages was so amazing, they also want to know if you're on the same thought of line for mail, envelopes, and packages.
Yeah, so in general, things like there was a study that showed and saw that the coronavirus potentially lives on things like cardboard for up to 24 hours. And plastic can be a couple hours as well. So there's some evidence that it might live on those surfaces. Again, those were sort of scientific experiments in a controlled setting, and we're not sort of out in everyday life. And so we're finding in everyday life that we're actually able, again, to track that the transmission is really mostly person to person. Um, but I would say that in practice, I would say the same thing that I said for sort of like the food packages to be true for other things like envelopes and packages and that come in the mail, which is that I would just take extra good hand hygiene. So I personally open my packages, dispose of the outer package as quickly as I can, and then just make sure I wash my hands. I think that's a good, safe way to do it. Is to just dispose of that outer package if you can, and make sure you wash your hands. And that really would minimize any potential risk that something was on the package itself. Again, we think that risk is low compared to the person-to-person transmission that I mentioned. But if you want to take every precaution, things like that, just to remove the outer packaging and washing your hands, can be an extra step that you can take to help yourself.
Great. Well, we were able to go through all the questions that everyone asked. So at this time, I just want to thank you so much, Dr. Carter, and thank everyone who joined and asked such great questions. If we did not get to your question today, please make sure you enter your question along with your name and phone number, and one of our guides will follow up with you. As always, you can give us a call at 1-800-DEVOTED if you have additional questions. That's 1-800-DEVOTED, which is 1-800-338-6833. Thanks again for joining us, and please stay safe.
Thank you so much.